All right, so let's move on to rule number 8. Don't hesitate to involve your seniors in order to safeguard your patients. Let's look at a question. On the morning ward round, your specialty trainee said that Mrs. Anderson is medically fit following her total knee replacement and could be discharged if occupational therapy feel it is appropriate. The occupational therapist has assessed Mrs. Anderson and believes it is safe for her to go home with a care package that has been arranged. It is now 4 p.m. and the nurse informs you that Mrs. Anderson is demanding to see a doctor as she does not feel that she is ready to go home yet. An elective admission is waiting in the day room for Mrs. Anderson's bed. Rank in order the appropriateness of the following actions in response to the situation. Okay? And once you've ranked your answers, the answer is A, E, B, C, D. Using rule number 8, as well as some of the rules previously mentioned, this is your correct rank. Now let's discuss this. Now, a patient is medically fit for discharge, and your ST has confirmed that. Your occupational therapist is also happy that she's discharged. So now you need to figure out the problem, why Mrs. Anderson is not ready to be discharged. And the first thing you would do in an ideal case is go ask her about her concerns. So this should be pretty straightforward. It might be a minor issue that you can probably solve. Now you know here that she is medically fit for discharge. Your ST has said that she is ready, but Mrs. Anderson does not believe it's safe for her to go home. Why does she feel that it's not safe for her to go home? She has had a major total knee replacement surgery, so she might be a little scared and feeling underconfident about her new knee. So the next best option is to get a senior or a specialist involved that can answer her specific questions, like the OT, occupational therapist, to come and speak to Mrs. Anderson with you. Now, why is the option E over B? Because B suggests ask a senior colleague to speak with Mrs. Anderson. You are taking a senior colleague from their job, asking them to speak to Mrs. Anderson and resolve an issue, even though she has been deemed medically fit to be discharged. However, in the case if it was Mrs. Anderson saying that she is not ready to be discharged, perhaps because she had shortness of breath, then you would definitely inform a senior colleague first before an occupational therapist, because there has been some changes in her medical status, perhaps a pulmonary embolism after a major surgery. But in this question, it will be an occupational therapist first before you ask a senior colleague. You cannot kick out a person without assessing them and telling them that another patient is waiting and that she has to go home. You need to explore their concerns. It is unfair for the patient admitted to be kicked out just because other people are waiting. And so the next best answer would be ask the bed manager if he can find another bed for the elective patient. Now, if you look at this independently, you did not go and assess Mrs. Anderson and explore her concerns. All you did was ask the bed manager to deal with the problem with the other patient. So it is kept quite down in the ranking. And then the last option would be D, to explain to Mrs. Anderson that bed has already been allocated and she has to go home. This is absolutely wrong. It might be a big issue that she might be having and you never explored it, and you are not making Mrs. Anderson and her concerns feel valuable. And nor are you putting patient safety into consideration over here. Okay, so now you can read the UKFPA rationale.